Nurse Aide Practice Test free online. Question 1. What is the correct order for putting on personal protective equipment, PPE? Option A, gloves, gown, mask, goggles. Option B, gown, mask, goggles, gloves. Option C, mask, gloves, gown, goggles. Option D, goggles, gloves, mask, gown. The correct answer is option B, gown, mask, goggles, gloves. The correct sequence is gown first, then mask, goggles/face shield, and gloves last. Gloves are most likely to become contaminated and are removed first during doffing. Question 2. The RACE acronym stands for: Option A, rescue, alarm, contain, extinguish. Option B, run, alert, call, evacuate. Option C, rescue, assess, control, evacuate. Option D, remove, alert, contain, extinguish. The correct answer is option A, rescue, alarm, contain, extinguish. RACE is the standard fire response protocol. Rescue clients in immediate danger, alarm, pull the fire alarm/notify, contain the fire, close doors, and extinguish, if safe. Question 3. A client with dementia is attempting to leave the facility. The nurse aide should: Option A, allow the client to leave. Option B, redirect the client to a safe activity. Option C, physically restrain the client. Option D, call security to escort the client out. The correct answer is option B, redirect the client to a safe activity. Redirecting to a safe activity is the most appropriate intervention. The client may be looking for something familiar. Restraints require an order and are a last resort. Allowing them to leave is unsafe. Question 4. A client with depression refuses to get out of bed. The nurse aide should: Option A, allow the client to stay in bed. Option B, gently encourage the client to get up. Option C, force the client to get up. Option D, call the family to get them up. The correct answer is option B, gently encourage the client to get up. Gentle encouragement with support and assistance can help the client participate in care. Allowing them to stay in bed may worsen depression. Forcing them is not appropriate. Family members should not be expected to manage care. Question 5. When a client with dementia is sundowning, becoming agitated at dusk, the nurse aide should: Option A, keep the environment bright and noisy. Option B, use a calm, gentle approach and low lighting. Option C, give the client a sleeping pill. Option D, ignore the agitation until it passes. The correct answer is option B, use a calm, gentle approach and low lighting. Sundowning is managed with a calm environment, low lighting, quiet, and a gentle approach reduce agitation. Bright, noisy environments are overstimulating. Sleeping pills require an order and should not be the first response. Question 6. The proper body mechanics for lifting includes: Option A, lifting with the back. Option B, lifting with the legs. Option C, twisting while lifting. Option D, lifting with arms extended. The correct answer is option B, lifting with the legs. Lifting with the legs, bending at the knees, keeping back straight, uses the strongest muscles and prevents back injury. Lifting with the back is a common cause of injury. Twisting while lifting puts torque on the spine. Question 7. Which precautions are used for clients with MRSA or VRE? Option A, airborne precautions. Option B, droplet precautions. Option C, contact precautions. Option D, standard precautions only. The correct answer is option C, contact precautions. MRSA and VRE are spread by direct or indirect contact. Contact precautions require a gown and gloves for all client interactions. Airborne precautions are for TB and measles. Droplet precautions are for influenza and meningitis. Question 8. What should a nurse aide do if they experience a needle stick injury? Option A, wash the area and report it immediately. Option B, wait to see if symptoms develop. Option C, apply pressure to the wound. Option D, ignore it if no blood is visible. The correct answer is option A, wash the area and report it immediately. Immediate washing reduces bloodborne pathogen transmission risk. Prompt reporting allows post-exposure prophylaxis if indicated. Ignoring any exposure is never acceptable and violates OSHA standards. Question 9. Which approach is best for a client with dementia who becomes agitated during personal care? Option A. Use a firm tone to assert authority. Option B. Provide simple explanations and allow choices when possible. Option C. Complete care quickly regardless of the client's response. Option D. Skip the care altogether. The correct answer is option B. Provide simple explanations and allow choices when possible. Simple explanations and offering choices. Example: would you like to wash your face first or your hands? Reduce agitation and maintain dignity. A firm tone can escalate agitation. Skipping care is not appropriate. Question 10. A client who is agitated and wandering should be: Option A. Restrained to ensure safety. Option B. Redirected calmly to a safe area. Option C. Left alone to tire out. Option D. Given medication to calm down. The correct answer is option B. Redirected calmly to a safe area. Redirection is the safest and most respectful approach. Calmly guide the client to a safe area and engage them in an activity. Restraints require an order and are a last resort. CNAs cannot administer medication. Question 11. When applying gloves, the nurse aide should: Option A. Wear gloves that fit loosely. Option B. Pull gloves over the cuffs of the gown. Option C. Wear gloves only for blood exposure. Option D. Reuse gloves to save supplies. The correct answer is option B. Pull gloves over the cuffs of the gown. Pulling gloves over gown cuffs creates a barrier preventing wrist and arm contamination. Loose-fitting gloves increase the risk of tears. Reusing gloves is never acceptable. Question 12. A client with dementia is pacing and appears anxious. The nurse aide should: Option A. Restrain the client to prevent falls. Option B. Encourage the client to sit down and rest. Option C. Walk with the client in a safe area. Option D. Leave the client alone. The correct answer is option C. Walk with the client in a safe area. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Pacing is a common behavior in dementia. Restraining increases agitation. Forcing the client to sit may escalate behavior. Question 13. A client with dementia is eating slowly and forgets to chew. The nurse aide should: Option A. Feed the client quickly. Option B. Provide verbal cues to chew and swallow. Option C. Puree all food. Option D. Remove the food after 15 minutes. The correct answer is option B. Provide verbal cues to chew and swallow. Verbal cues, example: chew your food, help the client eat safely. Rushing increases choking risk. Pureeing may be necessary for some but not all. Removing food after a short time may result in inadequate nutrition. Question 14. What is the first sound heard through the stethoscope when taking blood pressure? Option A. Diastolic pressure. Option B. Systolic pressure. Option C. Pulse pressure. Option D. Pulse deficit. The correct answer is option B. Systolic pressure. The first Korokov sound heard is the systolic pressure. This is the pressure when the heart contracts. The diastolic is the last sound heard. Question 15. When is alcohol-based hand rub acceptable instead of soap and water? Option A. When hands are visibly soiled. Option B. After using the restroom. Option C. Before touching a client with clean hands. Option D. After caring for a client with C. diff. The correct answer is option C. Before touching a client with clean hands. Alcohol-based hand rub is preferred when hands are not visibly soiled. Soap and water must be used when hands are visibly dirty, after using the restroom, and when caring for C. difficile. Alcohol does not kill spores. Question 16. What factor is not known to affect vital signs? Option A. Pain. Option B. Age. Option C. Hair color. Option D. Exercise. The correct answer is option C. Hair color. pain, age, and exercise all affect vital signs. Pain and exercise increase heart rate, respiratory rate, and blood pressure. Age affects normal ranges. Hair color has no physiological effect on vital signs. Question 17. What does it mean when a client is placed on droplet precautions? Option A. The client must be in a negative pressure room. Option B. The nurse aide must wear an N95 respirator. Option C. The nurse aide must wear a surgical mask within 3 feet of the client. Option D. The client cannot leave the room. The correct answer is option C. The nurse aide must wear a surgical mask within 3 feet of the client. Droplet precautions are used for infections spread by respiratory droplets. These droplets travel up to 3 feet, so a mask is required within that distance. Negative pressure and N95 are for airborne precautions. Question 18. When counting respirations, the nurse aide should: Option A. Tell the client they are counting breaths. Option B. Count while appearing to take the pulse. Option C. Count for 10 seconds and multiply by 6. Option D. Count for 30 seconds and multiply by 2. The correct answer is option B. Count while appearing to take the pulse. Counting respirations should be done without the client's knowledge because conscious awareness can alter breathing patterns. The nurse aide should keep their hand on the client's pulse site while counting breaths to disguise the activity. Counting for 10 or 30 seconds is acceptable for regular respirations, but disguising the count is key. Question 19. The nurse aide is assisting with morning care. The client prefers to perform their own care. The aide should: Option A. Perform all care for the client. Option B. Allow the client to do as much as possible independently. Option C. Rush the client so they finish quickly. Option D. Leave the room and return when the client is done. The correct answer is option B. Allow the client to do as much as possible independently. Promoting independence is a core principle. The nurse aide should encourage and enable the client to perform as much self-care as possible while providing assistance only where needed. Performing all care undermines the client's abilities and dignity. Question 20. A client expresses sadness about not seeing their family. The nurse aide should: Option A. Tell the client they will visit soon. Option B. Allow the client to express their feelings. Option C. Change the subject. Option D. Call the family immediately. The correct answer is option B. Allow the client to express their feelings. Allowing expression of feelings validates the client's emotions. Making promises, A, may be false. Changing the subject dismisses the client's concerns. Calling the family, D, may be appropriate but is not the first therapeutic step. Question 21. Which is a violation of HIPAA? Option A. Discussing client care with the client's family who is present. Option B. Discussing client information in the elevator with another aide. Option C. Documenting care in the client's chart. Option D. Reporting client information to the nurse. The correct answer is option B. Discussing client information in the elevator with another aide. Discussing client information in public areas, elevators, cafeterias, hallways, violates HIPAA because conversations can be overheard. Discussing with family present, documenting, and reporting to the nurse are HIPAA compliant. Question 22. How should the nurse aide communicate with a client who has a hearing loss? Option A. Face the client when speaking. Option B. Repeat the statement. Option C. Shout so that the client can hear. Option D. Use a high-pitched voice. The correct answer is option A. Face the client when speaking. Facing the client when speaking allows them to read lips and see facial expressions, which aids communication. Shouting distorts sound, and high-pitched voices are often harder to hear for those with hearing loss. While repeating may be necessary, facing the client is the primary strategy. Question 23. When measuring output, the nurse aide should record: Option A. Urine only. Option B. Urine, diarrhea, and vomitus. Option C. Diarrhea only. Option D. Vomitus only. The correct answer is option B. Urine, diarrhea, and vomitus. Output includes all fluids leaving the body, urine, diarrhea, and vomitus. These are all measured and recorded to monitor fluid balance. Question 24. A client is bleeding profusely from a wound. The nurse aide should: Option A, apply direct pressure to the wound. Option B, apply a tourniquet. Option C, elevate the wound. Option D, apply ice. The correct answer is option A. Apply direct pressure to the wound. Direct pressure with a sterile dressing is the first step to control severe bleeding. Tourniquets are for life-threatening bleeding not controlled by direct pressure. Elevation and ice are not as effective. Question 25. If the nurse aide observes a change in a client's condition, the aide should: Option A, document it in the chart. Option B, report it to the nurse immediately. Option C, wait to see if it gets better. Option D, ask the client's family what to do. The correct answer is option B. Report it to the nurse immediately. Changes in a client's condition must be reported to the nurse immediately for assessment and intervention. Documentation can follow, but reporting is the priority. Waiting could allow a serious condition to worsen.